Hey there, Nurse Awesome. Glad you're back. Now that we've established that care plans are just a way for us to provide evidence-based care to our patient, let's look at another really important piece of that. Care plans need to be patient-specific, and in order for them to be patient-specific, we need to start using the A piece of the nursing process mnemonic, ADPI. A stands for assessment, of course. You need to assess your patient. You need to go on a fact-finding mission. You want to know everything that you can know about your patient based on what's in front of you. So let's start with the chart. You're going to look at the chart with a really critical eye. You're going to take a piece of paper with you, blank preferably, because you're going to need lots of room to write. And you're going to start to note things on your blank piece of paper that are outside of the normal limit. Now, you've studied A&P. You know what's normal and what's not. You've learned your lab values, so you know everything's good. Just write those things down. When you see an L or an H on the lab values, when you see medications that you know may interact with one another or that cause specific side effects that you may need to address. Look at the surgical history of your patient. Look at the psychosocial history of your patient. Look at things that may be underlying medical conditions that don't have anything to do with the patient's current admission. For example, let's say your patient has congestive heart failure, CHF. Well, the fact that your patient is in the hospital for a fractured leg doesn't negate his CHF. It doesn't make his CHF go away, and you can bet your nursing care may need to focus a little bit on his CHF, especially if he's laying up in the bed for days and days, right? Right, now you're getting the hang of it. So you take a little piece of paper. It's got all the information that you can gather from the chart, and then you're going to walk yourself right up into their room and assess your patient. Yep, this is where your head-to-toe physical assessment becomes so important. You need to use your eyes and your ears. You need to see as much as you can about your patient's condition. You need to listen to what they're not saying with words as much as what they are saying. So once you've done that, you're going to list those things from your physical assessment that would help support any sort of nursing diagnosis that you may bring, any kind of care that you want to provide. So highlight those things and then refer to whatever it is your particular instructor wants for you to do. You know, some of them want a lot of diagnosis statements, some of them just want a few. Mine wanted risk and deficit knowledge as well as 3 that were priority nursing, So once you've listed everything, once you've used your teacher's parameter, I want you to start to think about what is it that's the highest priority for your particular patient. If you could only do one thing for your patient for the entire day, what would it be? What would it be? Ask yourself that question and examine the data. What's the single thing that would hurt your patient if it's left unaddressed, right? So if we refer to my patient from the other video, I totally missed the fact that his platelet count was low. I should have made some plans to prevent bleeding and falls. While that doesn't seem to be quite as important as some of the other things on the care plan to me, if he fell, it would be all over, right? So for my patient before, I had narcotics for pain. He was constipated because of the narcotics that he was taking. He had a really low food intake over the last few days, which was reflected in a low albumin level on his labs. He was pretty concentrated hemoglobin, and hematocrit, which meant he was dehydrated. He had some anxiety going on, and I could see that because he was really restless, and he just wanted to be out of the hospital. Also, his heart rate was kind of increased. He hadn't gone to the bathroom in like 5 days, so you know what? I knew that he was constipated. Most importantly, though, my patient had that really low platelet count that I totally did not see. So if I had been thinking, what is the one thing that I can do that will keep my patient the most safe while he's in my care today, I would have done something about the platelet count, and I would have chosen to care plan with number 1 priority, risk for bleeding. I didn't do that. So I want you to learn from my mistake. All of the bits of data are really super duper important. So what this assessment phase is doing for you, it's really teaching you how to develop critical thinking skills as a nurse. It doesn't seem really like that's what you're doing. It seems like you're kind of beating your head against the wall and just doing a lot of busy work. but there are so many pieces that are here. You're gonna develop skills in critical thinking that you're not really even sure. I mean, you don't even know you're developing them, right? The other real important thing that it's doing is it is helping you to learn how to organize data based on priority. Because when you get onto the floor as a nurse, you're going to be thrown a lot of things that seem to all be important. And you're going to have to assess pretty quickly the things that you want to do right now and the things that can be put off. This is how you're going to look at your patient's plan of care. What is it that I want to do, that I need to do right now to be the most awesome nurse on the planet to keep my patient super duper safe? What can I do? And then you make your plan of care based with that being the number one priority. So I want you guys to just kind of ponder that for a little bit. Doing a really awesome assessment sets you up to create an awesome care plan. And we're going to talk about how to set up that nursing diagnosis statement based off of all this data that you've gathered in the next video. So until then, you guys, peace, y'all.